Good afternoon, everyone. Welcome back to the 10th session of our program. Today's topic is relevance of palliative care during a crisis. And we have Dr. Athul Joseph Manuel as our resource person for today's session. Welcome, sir. And we have Ms. Riya Singh, who would be facilitating the session. So without much introduction, I'd like to hand over the session to Ms. Riya. Ma'am, please take over.
Thank you, Manisha. Thank you for coordinating this whole program. Thank you, Dr. Athul, for joining us to your busy schedule. We all know how busy you've been, and thank you for taking out this time to be here. Just a small introduction about Dr. Athul. Dr. Athul Joseph Manuel is presently working as a medical officer at the Department of Palliative Care at General Hospital, Ernakulam in Kerala. He's also currently coordinating the COVID-related activities of Ernakulam district. He's also worked at Amrita Institute of Medical Sciences and Government Medical College, Ernakulam, in the Department of Palliative Care. He would be obviously discussing the relevance of palliative care during a crisis. Currently, we've all been facing a crisis for the last few months. Also, the work his team has done, which has definitely been highlighted across the world about the response that they had towards this crisis. Also, just a small note, there were actually weeks on end that Dr. Athul had not even gone home. So this is a note that I want to let you all know that he's been working day and night. And last night, he messaged me at 10:30 in the night that he was working on his presentation. So you know how much he's working. Thank you, Dr. Athul, for taking out time. In terms of, we will try to use the chat option as much as possible. So if you want to take a break and we can raise a few questions to the participants. And as you will be sharing the screen, I'll read out the questions and the responses from a few of the participants as well. And I'll be co-facilitating with you. Thank you, Dr. Athul, and over to you.
Thank you, Shreya. Thank you, Manisha. Hope I am audible.
Yes, sir, you are.
So, yes, we have been fighting a pandemic for the past 9 months now. And I suppose everyone in the world is doing so. There is nothing much great in it, but it's our responsibility at the moment. And I would like to, today's session, I would like to force upon that I'm not an expert in humanitarian crisis in professional way, but just that for the past 3 years, our state, Kerala, has been having multiple crisis that is going on, and somehow I became a part of it from 2018, and ever since we have a good group in our district. I live in a district called Ernakulam, which is the center part of Kerala, and we have a close network of healthcare professionals who come together without even a notice when a crisis comes. So that's how we ended up with COVID as well. I would like to take you through 3 short presentations. One would be the basis of disaster management. I suppose most of you will be knowing how it is, but just to brush through. Oh, hope you can see the screen.
Yes, sir, we can.
Yeah. So going through, we know what is a disaster, though we can have a definition for everything. Disaster is something which disturbs us. It might be in separate ways, separate time frame, and whatever time frame it comes with a load that we have to bear. And healthcare has been a part of all the disasters because health is something which Rajawal sir always talks about as the well-being of a person, and when it gets disrupted, we have to intervene. And today's topic would be rather different from everything because palliative care and disaster usually doesn't go hand in hand in a first look, because usually palliative care is something which some of the healthcare professional calls as a luxury, because it's only after you have all the things, other things under control, that you need to even think about palliative care. But from our experience, palliative care has been played a pivotal role in most of the disasters, and especially I will be coming into COVID, where actually palliative care has risen above anything else during the COVID pandemic. So this is the usual disaster management cycle. You must have heard everywhere that we have to prepare before the impact. When we predict it, we have to have a good response system and have a good recovery plan as well, because always the disaster leaves a lot of menace in it. And mitigation is something, a new word most of you might have heard over the past 9 months, because ever since the COVID pandemic hit back from China, everywhere we have been hearing the word mitigation, because mitigation usually is just to lower the impact or just not control and tighten up the whole process, but to almost, if you talk about simply, it is like a check dam, where you have a check dam, and when the water flows and you are able to pause each and every time, control it, have it under control and move on. So yes, palliative care, we know the concepts of palliative care and what it holds for. Hence, healthcare has a synonym of palliative care in it. So, especially when it comes to disaster, this plays a pivotal role, because yes, we have been trained in our various sessions that we have to look at a person and a family rather than a disease, which really reciprocates in the whole of humanitarian crisis everywhere. These are the few of the relevant disasters that has happened and where palliative care has been very much played their role. And this might be our objective for the session, where we have to understand and define where palliative care fits in, and the whole ethical dilemma of the whole paradigm, and also just understand how a pandemic came and how we have to adapt in that, because adapting has been a scenario, especially for a pandemic like COVID, where the time has taken over the whole aspect. Because initially we thought of months, now we are almost confirmed in years. So yes, we have to. And Pallium had done a short study during the floods in 2018. They had come to Ernakulam as well, and in this whole concept entirely relates on Kerala, because we know we have almost a well-established government organization system, especially in palliative care in Kerala, which had a large momentum during the floods, and these were the most of the life-limiting diseases that that study came up with. And yes, old age related issues were the largest. And this is what I want to stress upon, because post disaster, it's always during the disaster that everyone comes together and everyone is together. But sad to say, post disaster, that much of concern does not come from all the ends that we expect during what happens during disaster. Hence, rehabilitation, which is an integral part of palliative care, rolls into play, especially post-disaster part. So, this is like we need to have strategy for a disaster, but I would confirm, like working in multiple disasters, that we can have a basic strategy, but each day comes with a new problem and we have to solve it. So, as we always say, there has to be a well coordination between the government and the helpful citizens of the local society as well as NGOs. And preventive measures, I would say, it depends on each disaster. So this was a legal framework that came upon with the disaster management. So back in 2005, we have 1968, the health emergency plan was already there, the Health Emergency Act. Then in 2005 came the Disaster Management Act from the center, and it was initiated by a 2017 guideline from Kerala. Then national and state disaster management policy came in. Finally, in 2016, we had a national as well as state disaster management plan. So I would like to tell us, is it getting boring for anyone?
Also, it's not.
Oh, Dr. Athul, please continue.
So I would like to go with a personal experience which brought me into humanitarian crisis. So it was basically the 2018 flood, because as you all know of Kerala, Kerala is not a state which has flood as common thing, especially in our district of Ernakulam. I will be speaking mainly with respect to Ernakulam. So the photos on this slide I wanted to share, because all the photos are taken in my phone. So it's like the whole flood we experience on our own. And this is the river Periyar which flows back to my home around 100 meters from my house. And the above picture was morning 11:30, and the below picture is by evening 3:30. So that's how the water came in. And by overnight, it should. I live in an island nearby the city of Ernakulam, and my island was totally washed off in that flood. And we were one of the last people to get out in a four-wheeler. Later, everyone was rescued in boats. So this was the third time the whole flood hit us, and before that it was in 1924 and 1961. So as of me, I had only heard in stories that there had been flood, and my grandparents had to take boat and get out of the house and all. But we had experienced it on our own. So it was the 15th of August, and most of the rivers, 44 rivers in our state, had overflown. 30 dams were open. The picture is of my dining room, which we found how it was laying after we got back after the floods. So there was landslides which are taking on tolls over death more than the water. And we have 14 districts in our state, and out of that, 12 were affected. And millions were evacuated. There, you would have seen photos of a pregnant woman who was evacuated, and as she got onto the helicopter and was landed on the hospital, she delivered a beautiful baby. And the whole death toll took nearly 500 in our state. So this is my district, which is a urban capital of Kerala. It is thickly populated with 1.5 million who are affected out of it. We had around 1,099 camps. So the another thing I want to stress upon is, as initially I told, we had a basic plan of humanitarian responses there in everyone. And camps, none of the camps were pre-planned. All the camps were set in according to the need. For example, a camp that was there near my home, the next day when I called up the Panchayat president there, the camp was reshifted because the camp itself had been flooded. So it is like you find a place which people can gather and it is a bit high. We would go there and set up a camp. If it's getting affected, yes, people would be taken away from them there and taken to somewhere else. So all these shots were taken. We had to take a helicopter once to the field visit. That's why we got these aerial shots. So once the water started residing, because initial 3 to 4 days it was basically rescuing people. Later it was when the water started to reside. By 19th the rains had come down, and then we were going in search of people, because there were a island where people were stranded and the church had fallen down, and around 6 people were dying corpus under the remains of the church, and all the rest of the people of that island were standing on top of that. So they had to go through that trauma for 4 to 5 days. They were standing on top of the dear ones, but they couldn't move anywhere because it was surrounded by water. So by 18th, our relief started. These are doctors on a helicopter and on army boats. Later, as a part of rehabilitation on a whole, we had medical camps which are followed for 1 year, with making a school into a multi-specialty hospital for a day and continuing any surgery or anything which is left over. So drinking water was a major issue, and we had chlorination started on the 23rd itself. This was the magic that happened in Kerala, that everyone came together. You name a person and he would be there. You name a service that is there in the government sector, everyone would be there working together. As I told earlier, nothing was planned, everything just came together. This was a district control room which we had initially during the initial phase of flood. This was a small room where you could see the district collector, the police, the health system, the motor vehicle department, public relations, the wireless services, water, everyone was sitting together. And I still remember when I get a call from a stranded place, all I had is to ask the next desk, which was of the police department, whether there's a possibility of a vehicle to get there. If it was a yes, I would go to the motor vehicle department. They would give me a Taurus, the truck you saw earlier. They would give me a Taurus. I would call my colleagues in the general hospital. 2 doctors will be ready. On the way, we would pick up some ration which is possible to take in the truck, and around 6 volunteers, and off we go. That's how it was happening back then, and that coordination was immense. And later we had a separate health control line, which was indigenously developed. We had a 24 hours helpline, and as you can see in the background, it's all medicines. Medicines are pouring in, and we had around 20 pharmacy students who were working day and night just to sort the medicines, because you can't just drop off any medicine anywhere. So they made into kits. You could see the blue bags, which are already ready with kits to be dropped off anywhere. And these are the kits that they made. And then came palliative care. So initially itself, NGOs like Tunnel, which are active in our area, they found out people who were bedridden, homebound, and they had a separate system for rescuing them during the floods. Then, just after the floods, after 19th, when the camps were set up and everyone in the camps, then we had a community nurses, which has already proven itself in the whole of Kerala to be a very effective system. These community nurses were already had started their work even without us calling them, because there were people with catheter in camps, there were people with wound, and these nurses with a decentralized system in a state, they knew how to take care of them with minimal medical expertise, or rather, I would say minimum medical amenities. So, yes, usually in the present era of multi-specialty centers, even for a wound, you might need a hospital to get dressed. But there were people starting their not just wound dressing, but making cotton balls and pads right there in the camps. So that gave a huge boost to us. And since I was working, and my mentor, Dr. Matthews, also works in palliative care, we knew there was a need for palliative care. And on the next day, that is on the first Sunday after the 15th, we had a meeting that was called upon of all the community nurses, because one thing we were sure about them is the communication skills that they have, and all they wanted to be taught is the post-traumatic stress symptoms that they had to look for. So we gave a small session training for them, and one of the saddest parts was few of the nurses who came there, they had lost their whole homes. One nurse had lost her husband during the flood because he got an heart attack between that, but still she came. So that was the energy that we got from our palliative care nurses. They were well equipped in terms of the communication skills, and they went into the field. So these are few pictures from how they went into the community where now people had shattered homes. But just a visit from a known person to just check on you was the greatest relief that people could get, because it was someone common from their village coming to their homes just to see if they are okay, if they had their medicines with them, they have to ensure that there are continuum of treatment, because there were many who are on dialysis, on chemotherapy, radiotherapy, all those were disrupted. So we had to early identify who all have disrupted the medications, not just in terms of medicines alone, but in other treatment modalities, and get them uh, back to their treatment. Also, initial signs of post-traumatic stress. We had a psychological support group. Both Pallium India was there, Mehak was there. Lot of NGOs came together and enhanced everyone. And we had a system where our nurses would pick up early signs of post-traumatic stress and notify them, and the team would go and help them out. So the main factor highlight of these 4 points that I would say is there was someone to listen to them, which was the most gifting thing for people in a district. And yes, we had later on we had an app-based system for Google Drive and everything, where we could track down who all had this predisposing symptoms of post-traumatic as well as history of any psychological distress. And as I said, Pallium India Nimans, a new NGO called Pradiksha came in, which is helping our palliative nurses in identifying those symptoms and tracking them. And various classes were also taken. This was a small data that was collected by our nurses. So in our district, our nurses visited around 10,686 homes, out of which surprisingly almost half had people with 5,129 had people with long-term illnesses. And this was a tab that Raja called me up and asked me to add, which is on that day. I remember he started a survey, not survey, home visit 2 days. Then next day, Raja also called me and asked to add this, where we just wanted to find how many children are there. And surprisingly, around 72 families had children below 18 with long-term illnesses during this. And we could identify 455 people were diagnosed of early signs of post-traumatic stress, and another 136 had pre-history of psychiatric illness. So these two are very important in that terms regarding post-traumatic stress. And as you can see, yes, there were around 74 which had their daily procedures which are stopped, and some with medications, but we were able to maintain. Communicable diseases, it was just a byproduct of the whole visit because we had a separate whole system for the communicable diseases. And this was a recognition that followed, where the whole process was documented and published in the Lancet World Report, which was an honor for all the nurses who were working in the field. And these are the two NGOs that helped us post disaster. Then we had to rebuild, because these are photos in front of my home and a house nearby my home. So after the maintenance, it was a huge burden to clean everything up. So this was my flood experience. And post flood came next year of 2019, where 2019 came with Nipah. And Nipah, which is a more aggressive disease than COVID, both viral itself, but it had a very close knit of surveillance team, because I guess the maximum people who were under surveillance was 350, and we had a list of palliative interventions needed in that place, because that second wave of Nipah that hit Kerala was in our district in 2019, and we were able to contain it. So not even one person died of Nipah or anyone else got affected. So we were in a pretty safe place. Then comes to our whole
Dr. Athul, can I just intervene for a
Yeah.
minute?
Yeah.
If just giving you a break for 2 minutes also.
Yeah.
If anyone has any experience they would like to share in terms of disaster response from that organization, their city, town, state, for anything, please do type it in the chat box. We can discuss it after Dr. Athul's presentation as well. Thank you. Please continue, Dr. Athul.
Okay. Thank you. Thank you, sir. So, yes. Our topic mainly comes into importance, especially during the present period of COVID. And yes, I don't think anyone needs any introduction regarding COVID, of what COVID is. Everyone has been living through it for the past 9 months. And I would like to congratulate everyone, because the whole world has faced this menace in a very positive aspect. Though, yes, there has been some glitches here and there, but still we have survived and we are still moving forward. And I guess it's a never experienced thing before in our lifetime compared to anything else, especially for us healthcare professions, where healthcare is the main. As I told earlier, during most of the disasters, healthcare is an integral part of any disaster. But when COVID came, COVID was a healthcare disaster, healthcare pandemic, and our roles came into different spectrum. Where usually, if you think it was mainly on the grounds of treating a patient, so when COVID came, we had to intervene right from mitigation to all the spectrum of things. And as I mentioned earlier, we have been working on COVID for the past 9 months non-stop. So it has been a life-changing event in every aspect. One quote is like, I called up Raja also 2 weeks back to see how he was. So I was glad that he was taking some rest at this time. But another point he told me was more than the rest, what he enjoyed is with his grandchildren, because he never thought he would have a family time again so much with them. So I'm glad that that is the case in most of the experiences. Just that there are few of us who actually have missed home more than everything for the past 9 months. And yes, this has been the integral tagline for COVID management without any doubt, because till now, any disease you name it, or anyone who was looking at the disease was just looking at the disease. But when COVID came, this came naturally. People came to understand that yes, when you call someone and tell that you have COVID, you need to be gentle. You need to think of the family when you think of the person, how you are going to treat and what they would be going through. And I guess hence us who are working in palliative care had a sense that people are understanding palliative care now more than ever. Yes, it's a again stressing that it is a better situation all over the world, but still something comes out of any any disaster, and I guess it has been a light that has given palliative care an aspect to show people that the real importance of palliative care, I guess. So regarding palliative care, when you talk about palliative care, yes, there is two types of palliative care. It is a basic care, which we give with the help of our community nurses, as well as in Kerala we have a second tier of nurses, which are specialist nurses, which are able to give a bit more high-end care in terms of procedures as well as handling high-end medicines. Home-based care was universal and the cornerstone of palliative care in Kerala. And in this aspect, we were mainly focusing on initially on quarantine. And now we all know that quarantine and contact tracing has outgrown the disease, or the disease has outgrown the whole quarantine concept. But still, as of now, I am on quarantine for the past 5 days because I had a primary contact, and hopefully tomorrow I'll be released from my quarantine. So quarantine thing still happens. And the beauty of palliative care is we have a heart and soul as nurses who are working in the field with the community, and the community embraces them more than anything. So whatever they tell, they'll believe, the community believes right away. Hence, nurses were a primary tool to impart the sense of the disease. And even with that short story, I still remember calling Rajaval's initial days. And me and sir was talking, and suddenly it came up as we were talking about the percentages of deaths. That is around, even for the COVID, it's like if 100 people get affected, around 40 will be asymptomatic, another 35 would be mild symptomatic, 15 of them would have moderate symptoms, out of which around 5, 10 percentage would need hospitalization. Out of 5, it might need ICU, and out of that, 1 to 2% might die. So we were talking about the what I would say, the vulnerable population of age above 65, these conditions on these medications. And while we were talking, we both realized that what we call as vulnerable population that is prone to die because of COVID was the population that we were catering to. So next came the question of what to do. And yes, what to do, it was a big question back then, but slowly we developed I would be coming to that, we developed a grid called Pallicovid, which we had a good session, echo sessions, multiple sessions. Once the paper was done, training had begun on based on that, and Pallium India had taken it forward with a lot of echo sessions, and it has been uh, roaming around the whole of India and elsewhere regarding creating a short start to what could be done during the COVID pandemic. And not just that, but we could prepare our nurses, prepare our patients and their family to look forward to what all can come and how it would be. And It has been an ever-changing game since March, because the rules that were in March does not stand now. The rules that were in August does not stand now. But I guess now we are almost stable in terms of policies. And then, because initially when COVID struck, all the COVID patients were taken to hospitals. So we were scared even when Pallium was stuck with COVID. So COVID positive patients means you need to be taken to some facility. That was the niche that was there. But now for the past 3 months, we have changed our attitude. And especially again, once in a discussion, it came up that if a bedridden or a homebound patient or a patient with health-related suffering, serious health-related suffering is getting COVID, most of the chances that he would have got COVID from some of his family or someone who visited him. So he won't be the alone person in the family to get affected. Hence, unless they want to get shifted, you don't need to shift them. So, and testing became a big problem where any person with signs of fever, cough, or uh, chest signs had to be tested, and to take a bedridden patient to be tested was almost close to impossible. But we need to rule out COVID so that we could give proper care. Hence, for the past 2 months, we in our district we have started testing at home. And we have trained our palliative care nurses, again our angels, who have been taught to do the nasopharyngeal antigen test, and if needed, to take a PCR swab. And they have been doing it, and we have got some people who are positive at home, and we have released many to be negative. And triaging, especially to take making a goals of care. We all talk about goals of care, and especially when a menace like this comes, and you have been tagged as COVID positive, the decision making becomes a vital part. I will come into that why it is a vital part. And though had to go all through all this, still now we are able to do some kind of home-based care. I wouldn't say totally, because even now we are shifting many of the patients since we are not able to get the message everywhere. But still, home-based care has helped us. And these were the initial cases where how you decide on going on a home care, because as we always talk, home care is a integral part. And when we go for home care, what are the personal protective equipments that you need to take? Because one thing about COVID that has happened is, since there was a precedence of Nipah, and uh, this precedence came with the PP, or the personal protection equipment, as we synonymously calling for the whole suit, which is actually not fully indicated in COVID. But since it came up with Nipah, it has followed through. And basically, it's mainly the face shield, the 3-layer mask that is actually needed. Even the mask is a vital part, but face shield and hand washing is additions that come into it. So these are the main things you need to look for, and you need to care for yourself. And PPS, if you are doing an aerosol generating procedure, it's better to have a PPE which is above waist. So these were the things. And telehealth helpline, another modality that came up during COVID, is telehealth helpline. I remember 3 years back that we started a short telehealth helpline in our palliative care program in General Hospital, but it became a failure because, especially with regarding to palliative care, our primary connection is touch. And when you come to telehealth helpline, the touch component comes down. But still, during this pandemic where touch was prohibited, telehealth helpline played a major role, because we created a telehealth help system, an indigenous for our district, which started back in. That's how I mainly came into play as a nodal officer of the telehealth unit. And we started back in March itself, where we had a phone number given to all the nurses, all the healthcare persons, so they could call to this helpline. It was not for public. There was a totally different number for public, but this was just for healthcare persons, where they could call and ask doubts and even decide on what to be done. And we had doctors on this end which were guiding them. And if there was any doubt or any symptoms which are suspicious, then we could do a video call follow-up and do a proper triage of what to be done and make a decision. And yes, as I said earlier, psychological help was mainly through touch, but now even we have learned to give some kind of psychological support through telemedicine system as well. So reverse quarantine. Reverse quarantine was I suppose most of you might have heard this name, reverse quarantine. Again, when I talk about this name, this word, I would go back to again talking with Rajaval because that was the first time we spoke about this reverse quarantine, whether it is a practical thing or not. Because when you go by strict rules of reverse quarantine, you need to lock down all the vulnerable people at home in a room. But for how long? So then we came up with different ideas. One was mainly, as we said earlier, this disease comes home through someone who gets it from outside. So, and yes, we know that lockdown is not a practical solution for COVID. Hence, the economy had to come back, the livelihood had to come back. Hence, people start going for work. So, when you go for work, we usually advise two kind of things, especially in terms of COVID. So, there are two ways that a person who goes out could bring this virus home. One is if he has taken proper precautions of social distancing, mask, and hand hygiene, then he would be bringing COVID on his out his body, on his dress. And if they have not done this properly, then they might bring COVID inside them. If you are bringing COVID inside you, there is no way that you can prevent your family from getting COVID. So whenever you go outside, make sure that you maximum try to keep social distancing, wear a mask properly, and practice hand hygiene as frequent as you can. So once, even if you bring COVID over your body, when you get home, all you need to do is straight away go to the shower, soak your dress and things in soap water, and also what you need to do is take a bath initially itself. So it is very, very, very important that you do so that you don't bring COVID home. Yes, I repeat. So whenever you go outside, make sure you do this. I am repeating again and again because now in Kerala, we have seen that number of cases affecting the vulnerable population has come up. Initial phase, it was people who are going outside. Now people who are going outside are bringing it home. And now most of the vulnerable people have started getting it. Hence, the number of deaths has gone up. So we have to be careful. There is no, you don't need to think in other ways in protecting a person because till now, healthcare professionals, whatever said and done, we were focusing on saving lives. And this is a technique which anyone can become a hero in saving life. You don't need to be a doctor, you don't need to be a nurse, you don't need to be a social worker to save life. All you need to do is keep proper social distancing, wear a mask, have proper hand hygiene. You will be saving millions of lives. So make sure you do that and practice self hygiene. So another aspect of reverse quarantine was old age homes, psychiatric homes, and even IP facilities where we have vulnerable people. So there we had given a strict vigilance on what to be done, especially when you take new inmates as well as have visitors there, also supply. And in my district of Ernakulam, we had the first old age home, which was basically a hospice setting, which had got affected with COVID. So initially one day evening, we got a call that around 40 of them are positive. And since I was on duty with COVID as well and palliative care background, I rushed there. And I still remember before getting the gist of the scene, I had myself inside the building. So I didn't know what was the situation inside because everyone was waiting outside and just staring at the building. There was a nun who was fragile and scared of what is happening. She had no idea. There are initially they found out around 20, 12 to 13 people who were positive. They got them in a small chamber, and rest they had no clue what how to go forward. So I had my hands tied up behind me, had my N95 mask. Me and my colleague we stepped in. We just went around and saw how things were. And we came out and then came to realize that it's not the 12 people. The whole of 116 inmates of that center must be considered positive because all are close contacts. And then we created it into an first line treatment center. We had doctors posted there to take rounds. And initially itself, we had a physician to take rounds and triage people on setting goals of care. And the magic was the physician who went inside was a bit aggressive and she asked me to shift around 40 people out. But they had an in-house doctor who had got palliative care training 2 years back from my institution, General Hospital, and I had taught her. So initially, since everything was in PPE, we didn't recognize each other. But later, the institution heads, the political party there, because we know that COVID has a big role in politics, political party there, as well as our health service came into consensus, and we were able to take care of all the people at home. We only had to shift around 6 people because there were psychiatric patients who could be resuscitated, so we had to shift around 6, and only one person died of COVID. Other 2 people who died were already on their end of life days. So, which was with this whole episode gave us a surge and energy to move forward, and knowing that if we give them proper care, even we don't have to expect that much. And we had a geriatric call center to make sure everyone is at home and keep calling the family and the loved ones. Palliative care nurse kept a close contact with everyone, and as I said earlier, we had testing facilities at home as well. We also came up with the idea of community pharmacy, which again came up during the lockdown period where we couldn't get the medicines there. But it has been continuing even now, especially for palliative care, where usually in government sector we don't supply medicines at home. But now we had a system with the field workers to supply medicines if there are no family members to pick up, or even if you have some proxy come in to give the medicine, so that we need to decrease the mobility of most of the patients and their family as much as we could. And um, now it's getting lengthy, but I'm coming to the end of the whole point where triaging, which becomes a vital part, especially in a pandemic. And we would have saw in war movies and all, like when you go for rescue, initially you look for people who can survive. And first is the children and women, then comes men, then comes old age. And especially vulnerable in those scenarios are left behind. But with the palliative care aspect, keeping that in mind, the importance of palliative care came into triaging, especially because, yes, during this pandemic, we know a definite medicine for the virus is not available till now. But all we know is the only thing that you can do for any patient is give them a good supportive care. And palliative care means good supportive care, especially focusing on the quality of life. So it was not about to intubate or not to intubate. Even when you're planning to intubate or not, you need to focus on the quality of life of the patient. Hence, what we are talking in palliative care for years and years were heard, and I'm glad that even our district administration has welcomed the whole concept of triaging. And yes, they had their own focus points on triaging because there would be proper utilization of resources, because we know the whole world crashed in front of COVID, not because of the dreaded disease, because we know any viral disease has a 1% death rate. It is the same with COVID. But the main reason that we had to, uh, at least some of the places had to come in front of COVID was the number of people who are getting affected at a time versus the healthcare facility that is available, whether it's a development or a underdeveloped country, was always overflowing. And in this overflow of healthcare, a proper utilization of resources was very, very vital. And our palliative care group, the methodology and triaging system that we suggested, not just gave the quality of life to our patients, but also gave the healthcare industry a proper utilization of resources. Because just imagine having 100 beds with 5 ventilators, and you have a vulnerable person who wouldn't be helped with the ventilator. On a ventilator, his quality of life would be down the drain, as well as that utilization of the resources also won't be justified. So this was, we were able to convince everyone, and I'm glad that we have started to implement that. And in this COVID triaging system, the importance of communications was realized. And I would rather say the consultations in palliative care, as well as the way the other people have started to use communication skills, has gone up tremendously. Because earlier the need for communication was not there needed much, because you would expect after an ICU rounds, there would be someone other one waiting outside the ICU so that they could hear what has happened. But now no one knows what is happening inside. So you need a communication system so that people outside knows, and people outside keeps calling each of us to see what is happening. Hence, we have set up a separate system for communication and addressing the issues of their loved ones. So I guess in these ways we have had a chance to come forward. And this was the Pallicovid grid that I was talking about, which we started formulating since March. And it has a whole booklet of symptom management, as well as triaging, which we are onto the third version this month, where we have modified triaging. We had multiple sessions with the intensivist and the pulmonologist and physicians, and getting a triage system with their aspects as well. And this, while the world echoes on poor quality of death in COVID-19, at least we can be sure, or at least I would say content, that we have at least a basic plan to give a good life till death for our fellow ones. So let us stay together while maintaining social distancing, so that we can tame COVID-19. Thank you.
Thank you, Dr. Athul. We've got some responses in the chat box. So I'll just read through a few of them. So this is shared by Dr. Rajni. She's a doctor based in Dubai. She's written, in Dubai, the disaster was managed quite well. Even though I was not involved in decision making, we worked only in the ICU. So we faced personal crisis at workplace. It started off with people panicking, people losing temper when they do not get adequate PPE in the early days, and frustration and helpless state when we would lose so many patients in the early days. Also, we have a message. We have Avtar, who's one of our participants who was tested positive himself while he was caring for a cousin with COVID in this group. Even though he had a few symptoms, but he's back now. We also have Alpa, who has written here. They run a group called Pehchan, a counseling service. So at Pehchan, they received a call from the daughter after her mother passed away in June during COVID times. She wanted to know what to do next after the death of her mother. I had to handle the case smoothly. There are handling many emotions during this such time. Alpa, can you please share your experience with this?
Yes, thank you so much, Riya. Thank you, Dr. Athul, for the wonderful session. See, this doctor called me from the hospital. Now the body was to be taken away, and she has to perform the last rites. But no doctor was willing to give her the death certificate also. So she literally had to go shopping from one hospital to other to get the death certificate, because the mother died of natural disease, natural death, and not a COVID thing. and they didn't have any COVID test report also. So for this, she had to go. Then finally, through some relatives, we could chip in, who chipped in, and we, through reference, we got a death certificate. Later, she was the only one with her husband at the crematorium, because nobody was allowed in the crematoriums also for the burial. And she didn't know what to do. She said, I've just brought my mother as is, where is, I don't have anything with me. So at that point of time, I told her, see, if you're wearing a chudidar, she said yes. Then I asked her, do you have a dupatta? She said yes. So just for a closure, I told her, why don't you put a dupatta on your mother's body? So you will have that you have done something for the patient. So later she did that and she felt very good. Actually, it was like a closer. Otherwise, I don't know how she would have handled that last few minutes or moments with her mother in the crematorium. So this was a very touching thing. It was in night around 1 p.m. all this happened. But whatever, all said and done, but I don't know, out of the box, I got this thought in my mind and I told her, and she felt very good. Post which, for 14 days, she and her husband were quarantined. So I supported her for that also. So this was one experience. And another one traumatic experience was during the earthquake in Latur. I don't know, in 93, if you all can remember, there was an earthquake in Latur. And I was the primary caregiver for my sister-in-law. She was almost 9 months pregnant, and she had started with her labor pain, and she woke us up. Within moments, the earthquake happened. But we told her, be brave, and why don't you change, and we'll call up the doctor and we'll take you there. So she was changing, and I was outside the room, and she was inside. And again, there were jerks. So that was the most difficult time. With great difficulty, we took her to the doctor also in the hospital. But that earthquake was very severe, and Bijapur was very close to Latur. So it was very much near the epicenter. So the effects were seen very much, but smoothly she delivered after 2 hours of the earthquake. So it was a normal delivery, but that 3-4 hours were really very difficult for us, because we wanted to save the mother, the child, and plus protect everyone in the family from the earthquake. So this I can remember and recollect very clear in my memory, actually. Yeah. Thank you so much, Riya. Thanks.
Thank you, Alpa, for sharing that experience.
You're welcome.
I think a lot of us faced it, especially with the last rites, and especially when all people who were dying needed a COVID certificate. And so it happened at a few palliative care centers also, where initially they were not testing for COVID, and last rites were a little bit of a problem. It happened with 2 cases in our care also. In the initial days, where the burial wasn't allowed
Yes.
for the people, and the family had to go through so much trauma. There's a personal case actually where the patient died under our care. He had cancer for a very long time, and this lady's son was had just come back from the UK, and he was also quarantined. So, but and then they weren't allowed to go for the burial, and there was a lot of issues that they faced. The son could, however, they tried to talk to the health authorities. The son was able to see the dead body for like a minute or so, and they were staying in an apartment, so the apartment authority had a problem. So there was a huge problem in terms of just not testing the body and not giving them a COVID certificate. So these are some of a lot of problems that were coming up in those days. I'm sure it's still there. I don't. There's so many things that we are so overwhelmed by this whole situation. Sorry, Dr. Athul, but there are some of us who stopped reading COVID news only. Like we're so overwhelmed. And like there are these funny memes saying initially everyone was scared, now everyone is sailing through COVID. But if anyone else would like to share experience or ask any questions to Dr. Athul, please write it in the chat box or raise your hand. and share your experience, please. Avtar, would you like to share your experience with your experience with COVID? Any other questions? Avtar has already written his experience. He also wrote about there was a very touching moment when a young person's son who died of COVID. He found courage, who came into his father's body out of Ganga Jal covered in his mouth. It was the saddest moment of life that I've witnessed when he was in ICU. Also, Dr. Rajni has written, has the COVID fatigue set in people? What do you think, Dr. Athul? Is this happening? Do you see in the past like 9 months the COVID fatigue has set?
Yes, COVID fatigue in both sense of us dealing with COVID as well as people who have got COVID. So initially, yes, the energy that we have, I don't know whether it's still fully there because it's been 9 months and it's almost, yes, we have been able to make a system where most of it would be running on its own, but still the issues that we come each day, the energy that we had earlier, at times at least we think, don't we have that right now? And even when you go out, so as Saya told earlier, when you go out, when you see the mob outside, you often talk to each other like, I think we are the only people who think about COVID right now, and everyone else is least bothered regarding it. But that is how life should be. We have to move on and get adapted to it, especially with a long pandemic like this. There is no point in getting in and staying away from it because life has to move on. And regarding the medical part of COVID fatigue, post-COVID is coming up in a big manner now because like all the other viral diseases, COVID also has the post-COVID syndrome, and out of which 33% has COVID fatigue, severe fatigue due to COVID. And we are starting post-COVID clinics as well, where some are having cardiac myopathies and some are having neural disturbances, some are on long-term oxygen therapy. Today, one of our senior doctors passed away post-COVID. He got negative 1 month back, but his lungs didn't recover and he passed away today morning. So, yes, post-COVID things are coming up and we have to be prepared for that as well. And picking up early is the only way out of it. And especially since they are not infective, we can remove that thought process in our head because like when I was in quarantine for the last 3-4 days, I watched 2-3 movies and there were people crowded. And when you see a crowd mob, something comes into you like, how can we I look at them there? So that is kind of feeling that has come into us. We often used to say that earlier we never thought of where our hands are going, where we have touched or what we have touched. But now, somewhere in our subconscious mind, we have the consciousness that I have touched somewhere, then now I have to clean my hands, otherwise it's dangerous. So that is kind of consciousness that has unknowingly come to us. I hope that drains away with COVID because it's not a good sign for us to be humans and not touching each other. So yes, it has brought in a lot of fatigue, and some people are even predicting a world depression after this because this whole isolation has taken a toll in all aspects, especially as you all told earlier, post death. Because being in the control room, it's almost a daily affair that this happens, where a father might have passed away with COVID, mother will be in one hospital, some son will be in another hospital, and there won't be any means to show them. So what we did once and all we did was we took this person in an ambulance to each of these hospitals, showed them there, and then took for burial. So there were multiple issues that come up, especially with death and that during COVID. And luckily now we have enough tests so that at least the unknown deaths we could classify non-COVID and non-COVID and give the body back to the family for rituals. But COVID that still has trauma, but compared to earlier times, it has come down and just bit more liberalized. But still, that trauma is sinking in, and it makes, as a person who have lost my own father 2 years back, still I have not been able to recover, and I can't imagine a person who has to go through where they can't even touch them during the last ritual days. So it's it's a thing that we have to live with, but it's not something that we want to live with.
Hello, doctor. Sorry for
Yeah.
your loss. Um, Actually, I want to ask one question. That while I was in
Yeah.
hospital, they were very much into it that I should go on antidepressants. When I told them that I don't want any kind of antidepressant because I am a God-fearing man, I was very much emotionally stable, but they wanted me to put on antidepressants. Was it necessary to be on antidepressants? Because when I asked them, they said me that see all around you, all people are normal, and the things that which you have developed in your lungs and all, they won't go rapidly. Means you will be suffering very long symptoms for a very long time. Means this kind of impression of professionals was very depressing for not only for me but for other persons who were sitting beside me, uh, who were suffering the same symptoms. So I think this COVID thing actually, people were not very much educated about it. Do you agree with this, doctor?
Yes, of course, Avtar, like as I told earlier, the guidelines that were there in March were not there in May. That was developed in May, was not there in July. So what we must understand is it's a new disease, and it's not just a disease that is new, but the whole process is new, because never in the history of modern medicine that with this kind of technology in hand, we had to go through something which we had no prediction about, and the volume also was high. So generalization came in lot of ways, not just, as you said, not just in antidepressants, but in most of the medications were on trial basis or the gut feeling of the system, because there was no clear protocols, though there were some guidelines that were coming up, but that also kept ever changing. And regarding antidepressants, I guess it was like a prophylactic aspect might be with that hospital that you were in. In my personal case, also when I was bedridden long back, after I had two episodes of dengue virus hit, I got a prescription which had an antidepressant, and I was finally a medical student back then, so I could make out that it is an antidepressant. And even I thought of myself, why would this person give me an antidepressant when I had no problem with me at all? But down
Yes,
the line, after being bedridden for 2 months, I came to know that what was the indication that was there. But I'm not telling that it was the right decision. But when you generalize things, yes, things might happen here and there. And depression is something which comes along with COVID, not just because of the disease itself, but because of the way you are treated. Because before COVID, when you go into a hospital, you could see someone smiling at you, but now you have people in suits that come to you, which they don't have the energy to communicate with you like before. They would just do the procedure and go. So they just, and we have had many of the aspects where we had suicidal points, and many number of cases of depression coming from COVID patients, especially inside COVID wards. Not just COVID wards, even you could think of people in quarantine. So that self isolation, we are social animals, and that is the basis of human being. And isolation is an antisocial aspect, and when that kicks in, yes, depression is a natural thing that comes to us.
yes.
And I guess that's why that might be the reason that hospital had started antidepressant earlier on.
I just now came to know about just a few days back that coagulation was the main factor for most of the fatalities that occurred during the early phase of COVID. So I think as study will progress, we'll come out with the new findings and all, and even the adverse effects that which I have suffered in my lungs. I got one lesion in my lung too, and thankfully no scarring. But I think eventually I will also get treated some way or the other. Thanks, doctor. Thanks for your input. Thank you. Thanks a lot.
Yes, coagulopathy has came up, though it was named back in March, April early itself, but it was not given due importance. But I guess over the last 3 to 4 months, coagulopathy has gained its importance in treatment of COVID. And as of now, low molecular heparins are an integral part of treating COVID, because the two aspects that brings about fatalities, one is the lungs, which has nothing to do with coagulopathy. But there are cases where the lungs are pretty clear but still the patient is very lethargic or symptomatic, where you could see the clear picture of coagulopathy and cytokine storm. So now we are having systems where we could do a blood test and earlier on pick up those signs and start on low molecular heparin as early as possible.
Thank you, doctor. Thanks a lot.
There's also, because there are a lot of mental health professionals in this group, they've also discussed that the anxiety-related issues with people post-COVID has increased. A lot of psychologists are dealing with many anxiety patients. Prasanna, you've written a long chat. Would you like to talk about that? If your internet is fine. Sriya?
Yeah, can you hear me?
Yes, we can.
Yeah, this happened in early September. I got a call around 7 o'clock in the night, 7:30. The girl just introduced herself as my son's former basketball master's daughter. And her father was admitted in a hospital, and he was to be discharged, but a certain amount of the hospital charge has to be paid before his discharge can happen. And all she spoke was in a very short time, and there was a lot of information given. So all that I could gather at that point was her father was COVID positive, and it's only upon which he was even admitted into the hospital. And the family was not allowed to see for 3 days. And on the third day, they were informed that he can be discharged and he's not COVID positive. So no explanation was given as to why the family was not allowed to see. And all of them are first generation graduates, which means none of them have even passed their 12th. So the daughter has just entered her college, and her elder brother, just 2 years elder to her. He's 19 years and she's 17 years. So the daughter took the father's mobile contact, and she started calling people for financial support. And she said none came forward, because whatever the contacts were with the father would be of people working with him. He was earlier the basketball master, then he had a stroke, so he was made the peon of the school. So he had contacts which were not of level where they could give finance for a private hospital's fee. And finally, the call came to me around about 8:30. So I told her I can help only with what source I have, which means financially what I could help her with. But then hearing a voice the whole night, I couldn't sleep. She was just 17 years old, and she was trying to get help for her father. And I started asking people randomly whom I knew, whom I didn't know. And I landed up with one such NGO. And that NGO, which is again run by children, all of them are students. They are either engineering students or college students. They started an NGO called Helpify. It's through him, through Helpify. By next day, the hospital said he has to be discharged, come what may. We can't do anything. But his oxygen level was dropping. And they said we could at the most recommend which government hospital you could go to. And they gave the name of the government hospital, but for which the son and another relative had to make a recce to go and see whether there are beds available. So they found beds were available in this government hospital. And they came back and they said, okay, we have made our recce, everything is fine. We can discharge and we can take him to the government hospital, but we need to pay this amount. So by then the funds started coming through Helpify, which I had asked for. And I too started giving. They were short for 75,000. I have not seen the face of their daughter before. It's just upon faith. All that I told her is, I'm loaning this amount and I'm giving it to you so that you come out with your dad. Later on, we'll see. Let him come back home and later on, we'll see about how you can settle this amount to me. And I thought the problem was solved because they were discharged and they were heading now to the government hospital, for which already the family had made a visit and they found that there was room available. But 12 o'clock in the midnight when they landed, the government hospital refused to give them admission because they said this is only for COVID and he's not COVID positive, he's COVID negative. Based on his oxygen level, we can't take a patient inside. So that man was outside for almost 1 hour, from 12 midnight to 1 p.m. he was outside till the ambulance driver had to intervene and he had to speak. By then we had to move through our source, catch hold of somebody really big from the government hospital sector, and on basis of humanitarianism they gave a room. And for 1 week again the family was not allowed to see the father. And after 1 week he came back home and how he's gone back to his work. It's all happy and happily settled. But the trauma that they underwent, be it in the government hospital as well as the government, for 17 year and 19 year, it was too much. The mother's not educated. So I have not spoken to the mother even once. I saw her on the day when she came with the son, when she came to the bank, because only certain amount could be withdrawn. Certain amount could be done as a bank transfer. Anything beyond 50,000, the bank doesn't allow, because that's the first time I'm even transferring. So I had to see them in person and give them the rest as cash. So she didn't even have words to speak to me, but she just held my hands and she just thanked me, because I'm seeing her for the first time. I have not seen her before. She said, on what basis you're giving me the money? I said, on what basis your daughter even made a call? She felt that somebody would come and help. And she felt that I could help with whatever I'm able to help. If the 75 is able to bring them, if that's the amount you're running short of. And I'm not the angel here. There's another NGO called Helpify. They were able to get a amount of 75 to 90. Even after he got discharged, when he came back home, there were people who were willing to support him, because primary amount was from the father's side. Another relative, he had taken a loan from his office. So 1 lakh was brought in like that. I gave 75. Helpify gave about 75. So we all of us pitched in money and we brought the father out from the hospital, and things went fine, I would say. There was no death, but we don't know whether he was COVID positive or COVID negative till the end. We felt that the person is back home and he's normal. This is one of the worst things that could happen during a COVID situation. From the family's point of view, they never thought they will see the father again, be it in the private hospital or in the government hospital. And the girl is now calling me as a mother. She's calling me Amma now. I felt happy. I don't have a daughter. I have a son. He's about 21. She says, on that day, I don't know, you came as a fairy in my life. I could call you nothing but my mother. I said, welcome. This was one of the situations.
Thank you, Sriya, for sharing that story, and thanks for all the effort that you took to help out the family. And sometimes, yes, there are angels who you never met and how they help you. I think all of us have those experiences where a stranger helps you in any little way possible and you never expected. Thank you so much for sharing that. Also, Dr. Athul, I wanted to ask you about personal experience that even we had. Initially, during the month of April, we sent out a call for volunteers to do various work in terms of delivering medicines, also however people could help and support food kits, delivering food kits and everything. But initially, a lot of people signed up and, we could do a small virtual training for 2-3 days. But now we don't see those people because everyone's going back to work. So that's also, even though it is a lot of communities involved here, do you have is that also any experience that you have faced, that initially a lot of people were involved from the community as volunteers?
Yes. So yeah, like especially initially itself there were short of volunteers, even though during the lockdown period. Because I'm not telling that there were no volunteers at all. We had a lot of volunteers, and even my telemedicine system, our telemedicine system was 90% run by volunteers. But compared to the volunteership that we had during the floods, so I still remember the days that we were starting. We were making multiple calls daily. We were calling for help from whichever way we could. And I still remember I calling 2, 3 NGOs which provided thousands of volunteers during the floods. And I called this secretary, and he told me, "Sir, yes, like last time, I'll get you at least 1,000 youngsters to deliver medicines." And by evening, I didn't receive a call, so I called him back, and he was like, "So only 25 are agreed till now. Still, their parents have not fully agreed, so we'll wait." And sadly, only 10 to 12 came. And even post the lockdown, there were a lot of people to volunteer because many were jobless at home, and not in just terms of monetary, but otherwise also they had nothing to do at home. So they were doing whatever they could being at home. And later on, for the past 3 to 4 months, the number of volunteers that has come is almost to stand still because everyone has is got busy with their work, and there has an economic crisis that's going on. So everyone is behind a buck where they could save something for their family. And at this point, yes, it's sad, but it's a truth that number of volunteers has come down. So I guess, but still we are surviving, and yes, it's a part of life where, as we always tell, we have to get accustomed with the whole COVID. People are getting accustomed and finding help in their kith and kin as well. So, but another good thing might be that they, even the family has now has an idea of what could be done for them and how to help each other. I guess that instinct has come up better than earlier. And I just want to clarify regarding the story that Angit told earlier, where there's a lot of confusion between COVID and non-COVID. And there are papers which say that irrespective of test, if your patient is having uh, severe distress in terms of breathlessness, consider them as COVID and treat. And there were sad stories, especially as I told, since we are in the control room, we get to know each and every story that is happening in our district. And I remember back in March, April, where people were scared of COVID, especially hospitals were scared of taking COVID patients. We had a patient who passed away just because he was a suspect of COVID, just because he had cough. I remember the whole story where the patient went to a hospital early morning, 5 a.m. He was given some medicines, came back home, went to another hospital by around afternoon 12 to 1. He was not taken up there. They gave some medicines and they told it will resolve. And just because he had a cough. And by midnight, when he went to another hospital, that hospital referred him to the government sector, writing that they suspect COVID. And when the patient came to one of the government hospitals, he reached by around 12 and he passed away by 12:30. And when the blood reports came, it was a definite myocardial infarction. It was a heart attack, but it was mistaken for COVID. So that is where the fear plays the trick. Hence, we should not be scared of COVID, but all we need to do is be vigilant. Because if we get scared, then we can land up in trouble. Especially both the stories both imply the scariness, where even the antidepressant are not giving treatment. So this whole when we get too much scared of a thing, that gets to you. So never we should have a system where we should be vigilant of COVID and do whatever we can, but not overdo it, which can result in. Since we need to have a proper COVID and non-COVID system everywhere as much as possible, in the hospitals and clinical settings where we do not cater directly to COVID patients, make sure that you have a proper triaging system outside where you triage people who come inside. Not checking for fever is just one of the things, but have a history and make sure that you don't get a COVID patient inside, a COVID suspect inside. And if you have a COVID suspect, make sure that he gets tested, and if he is negative, he gets proper treatment, or if he is positive, he gets a proper treatment. So proper triaging is the only key where we can save people from getting affected and give proper treatment for both positive and negative people.
Thank you, Dr. Athul. Also recently, I'm sure Dr. Athul, you know, there was this webinar with WHO Director General Dr. Tedros on November 25th, where there was a interactive civil society dialogue where he spoke about integration of palliative care into national COVID response. So this was something that was recent on the 25th. So there is, yes, there is a lot more traction in terms of how palliative care is important, and people are getting to know. You can also see something through our attendance for online classes, through the Pallicovid program that we are also doing, a program like this, which was started during the COVID time. So there's a lot of traction now in terms of people trying to know what palliative care is and how they can help. So any other questions? And also, sorry, Dr. Athul, one thing I'm going to ask you, how do you manage self-care? How do you care for yourself in these times? Because everyone's a healthcare professional. You've been working so hard for so many months. So if you could let us know your experience about how you care for yourself in this time.
Actually, I wouldn't tell as that I'm caring for self much, because at times, as I told earlier, the energy drains and we stop or we pause. But I guess it comes with a self-coping mechanism where, as I told, after my father left us, I have never been outside my home because I am the eldest at home. Uh, every night I make sure that I come home. But since 9, my family supported me in a big way. Where I still remember my mother calling up and telling that anyway, you're not going to go out abroad and work. So I'll just imagine that you have gone to US or UK, so that you are working somewhere and we are at home and we'll be safe. So that's the support. Once you get that support from the ones you need to care about, so that gives you a lot of energy. Next is the cohort that comes in, where thankfully we had a lot of people coming and going, but most of them had that similar things inside them where we could share to each other. I think, yes, when I look upon each day, yes, we are working 24 hours, but we have a lot of chit chat in between that. Yes, it might be revolved around COVID, that people might not like when you come from outside and come into a chit chat where still we are talking and pestering about COVID, but whether it be COVID or not, we are having a group discussion and it's a group effort, which makes it easier, not just in taking decisions and taking in a proper decisions, but also sharing your ideas, sharing your thoughts, sharing your grievances. And there might be nights where we might talk about our childhood and how our college days were. Then I would talk about college days. It's not just me that is here. We have around 60 to 70 people who are staying here, and I have 2-3 of my colleagues of my rank itself with me since March. So we sit around. We might talk till 2 a.m. And initially, yes, the talks were mainly regarding Italy has gone to this number, US is running behind, India is coming behind. When will India come? I remember still most of the days by it's around 1:32 that Worldometer website gets updated. So that's when we will be discussing. And at times when you see the figures, it becomes sleepless till 4 a.m. So you see the number in Italy, number in UK that's coming up, and we'll be like, what are we going to do? And so those were those days. But now I guess we have a lot of chit chatty moments, which actually has helped me in my personal experience to move forward. Because we have been planning for a trip since May. We always still will take 3 days off and we'll go somewhere, but it has never happened because it has almost become inevitable to be here. But still, even without that trip, I guess we are able to cope up and move forward. So I would ask everyone to share. Like, that's the magic in sharing. Share your thoughts with the person or the people you can trust and move forward. Because I am not sure whether even a vacation would help. Because you go for 3 days, you come back to the same thing. So you better have a system within the system where it helps you move forward.
Thank you. Thank you, Dr. Athul. Yes, family is important. Definitely. So I'm away from family in Kerala. So so my family is back in UP. So initially at UP, you know how people I think forgot about COVID months ago. So, and I have my elderly grandmom and everyone at home as well. So I'm always like checking on them. I'm like, oh, you know, here shops are not open till after 7. Like maybe a month back, I'm like, shops are closing by 7. They're like, oh, but we are going out shopping at 8:30. I'm like, oh my God, they're all elderly people in my house. So they have given up. They already had given up on the healthcare system. They've given up on COVID also. So yes, we hear so many, and as healthcare professionals, you know, we have to keep kind of giving them reminders. You know, okay, you know, it's time. You better don't do that. Come back home. Stay at home. So thank you so much for today's session, taking out time for all of us. I'm sure all of us learned a lot from you. And we need more humans like you in this world to make it better, not just when a disaster comes, but on a regular basis as well. And also for bringing in this awareness about how palliative care can be integrated, whether it's a disaster response for anyone, and how our vulnerable patients should not be ignored during during any disaster or in general as well. Thank you so much, Dr. Athul, for your really enriching session. And all the participants please read the chat box. Everyone's really delighted about your session. And thank you so much for taking out time. Thank you.
Thank you, Sriya. Thank you, Manisha, for having me. Thank you, Tips and Echo. And yes, Pallium India has been very close to me because I guess I met Raja also back in 2012.